Hi, I'm your host Diane, and we're joined by Dr. David Graham. He's an infectious disease doctor here in Montana, and we want to thank you so much for inviting us by your beautiful home.
Diane, It's nice to see you. Thank you for being a friend and the consummate professional you are.
Of course, it's great to be here. It's so beautiful. You are the author of this brand new book. It's called From Killer to Common Cold. And you're also a dad. You have twins, another child. A lot is going on. The worldwide pandemic, of course, you being an infectious disease doctor. You're a little bit busy. I want to know, how do you have time to write? Because this is where the magic happens, right here on the farm, right?
Right. It happens generally at 2 o'clock in the morning between diaper changes, to be honest with you. So,
okay.
Yeah, no, but that's honestly how I started writing was, you got to do the night shift and you got to get it done. And it's kind of hard to go to sleep when you got twins and nighttime feeding. So I started writing a blog, and then the pandemic happened, and decided to write a book.
Right, and this is something that is truly great information for folks because everyone wants to know what's next. So tell us a little bit about the book.
So the book tries to take a little bit of a common sense view to this. I don't know if you've noticed, but we're getting a lot of mixed messages from the politicians and the media and scientists. And instead of trying to drink from the hose of science and all of the do this today and do something different tomorrow, I wanted to step back and look at human coronaviruses, because there are coronaviruses besides COVID-19,
Right.
and we can actually learn a lot just by understanding kind of science theory rather than the give and take of what's going on in the medical journals today.
Right. This is such an interesting look. It does take a step back, and it says what's happening in the next 2 to 5 years, not just what's happening next month or what are the numbers at today. So it's a very great read.
Right. Yeah. So I've been really disappointed that folks haven't been telling us what's going to happen. Where are we going to be 6 months from now, a year from now? It seems like they're saying we'll just wait for a vaccine and the world is going to be different. And frankly, it might not be different. It might not be all that different than where we are now.
Right. Okay. So what are some of the key takeaways for the average person?
So the key takeaways are, by looking at the common cold coronaviruses, which we've all had before, they're in daycares around the world all the time. There's 4 of them. Kind of the key takeaway is that even if you get some immunity to it, it is not long-lived and it's not permanent. So
Right.
even if we do get a vaccine, the goal is that it's 50% effective. How many people are actually going to take the vaccine is another question.
Right.
But after 6 months or a year, you might be susceptible to getting COVID-19 again. So we're going to have to go through this transitional phase, 2 to 5 years, where COVID-19 is still here with us, and then eventually it will become the common cold. It will become the 5th common cold coronavirus.
Okay, well, that is great information. Probably something that a lot of people maybe wanted to hear, is that it's going to turn into the common cold. It won't be this thing that we have to be scared about all the time.
Right.
Okay.
But we do have to get from here to there, and that is a little bit of the scary part, is that
Right.
there are still vulnerable people, right?
Right,
There are still loved ones that live in nursing homes and other folks that have medical conditions, and they're going to be susceptible to getting this for quite a while now. So having to deal with COVID in the world means interacting with our loved ones that are vulnerable.
Right. Okay, well, great information in this book. We want to know some of the details. I know it's 111 pages long. It's a nice, easy read for folks. Very good information. Where can people find it?
So it's on Amazon and then Barnes and Noble and a couple other places for the ebook version of it.
All right, and then people can head over to your website, right?
Sure, yeah, that's
Okay.
fiphysician.com, fiphysician.com.
All right, well, is there anything else that you'd like to add, David?
No, thank you for stopping by, Diane.
All right, well, Dr. David Graham, we want to thank you so much for joining us.